This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Jennifer Bender, Perinatal Nurse Navigator, internationally board certified lactation consultant. We'll be talking about prenatal and postpartum care, but first let's welcome Jennifer into the program. Good morning, Jennifer.
Good morning. Thanks for having me.
Well, thanks for taking a few minutes with us today. We will jump into the subject at hand in a moment, but first we would like to get to know you just a little bit better. So tell us about your background, where you're from, your education, and how you ended up with Mon Health.
Great, thank you. I'm originally from the D.C. metro area, southern Maryland, about 50 miles southeast of D.C. My husband and I and our family moved to West Virginia in 2006. We absolutely love it here, raised our family here, and don't plan to leave. It's a great place to be and raise a family. I'm an associate's degree nurse and became a lactation consultant 20 years ago. This is my 20-year recertification, so super proud of that. And I love Mon Health. It is the place to come, the place to work. I actually live in Shinston, so it's a little bit of a drive for me, but absolutely worth it.
So how did you choose your specialty? What drew you to it?
Well, I went to nursing school as a single parent, so I had 4 kids and had already done labor and delivery a few times and just really loved it, thought it's something I wanted to go into. And then when I completed nursing school, was fortunate to be able to get in a specialty at that time, 21 years ago. It was hard to start in a specialty, a little bit easier today, and just always had a passion for it and just have continued in it.
All right, and before we jump into the subject at hand, which is going to be prenatal and postpartum care, where do you practice?
Yeah, so I practice at Mon Health. I have an office at the OBGYN office in Morgantown, but I also work remote. So the job I'm in now, I do everything from my cell phone and my computer and the outreach program we have. I am in the office for follow-up lactation visits, which is awesome for our population to have support to meet their goals. So that's where I am, a little bit everywhere, to be honest, but I love the job flexibility. All
right, let's jump into it. Can you tell me what the Progressing Through Postpartum Program is?
Yeah, Progressing Through Postpartum, or P3, as we like to call it. This is a follow-up program that was started in January of 2020. Our very awesome administration got behind maternal mental health and really wanted to start a program right here at Little Mon Health that is growing rapidly. And so what I do is I reach out to all moms that deliver at Mon Health after delivery through messaging and just let them know who I am, and I'm here to help. I can help with their new baby questions, their postpartum recovery questions, and any feeding questions. And that helps just allay a lot of fears and, not get on Google, which is a pit.
That's good advice just in general there, I think. Just don't try to Google it. But
don't do that.
How many new parents, new mothers come to the hospital or enter, starting the process of prenatal care and pregnancy, thinking the process goes, okay, you deliver the baby, you take baby home, that's the end of it. That's right. Not true. There are services available, as we're talking about today. But how many think that's the way it works?
Yeah, many think. And honestly, we spend a lot of time taking care of moms in pregnancy. And postpartum, we don't do such a great job. And ACOG, our, recommending agency for obstetrics, has recognized that, which is great. And so we are upping that outreach and that follow-up. So traditionally, you have the baby, you come back to the OBGYN office 6 weeks later, everybody says, see you later. Now we do a little more close follow-up, especially for moms that are at risk or having symptoms, and we continue outreach actually throughout the first year. I am available. I tell people once you're in my phone, message me anytime. I have your contact. And I outreach again at 3 months because symptoms of depression, anxiety, and mood disorders don't just magically go away 2 weeks after delivery. They can actually show up anytime in the first year post-delivery.
How many mothers experience what we're talking about here, prenatal anxiety, depression, those mood disorders, before and after pregnancy?
So that's a great question. Up to 70% of women will experience some mood changes related to pregnancy and postpartum. 70%. Now, not everybody needs intervention. Some people just need a little more sleep, to eat a little better, get a little more self-care. And sadly, only 6% actually seek treatment. So we are absolutely under-treating this and under-reporting it because, well, everybody said, oh, yeah, that's what happens when you have a baby. But that isn't what should happen when you have a baby. So, yes, we're upping that outreach because we know that people are under-reporting.
How do you, or can you tell the difference between, and I'm maybe wading into dangerous territory here, Jennifer, pregnancy hormones, and that's just part of being pregnant, and that there's something that does require some therapy and some intervention? How can you tell the difference?
That is actually a great question because, yes, being female, we're pretty hormonal at times. There is a difference between I really feel out of sorts today and I can't function. I'm crying all the time. I'm worrying about everything so much that I'm in a constant state of panic. And what I tell people that really have never struggled with depression or anxiety is no one would want to feel this way. A lot of people, in the years past, we said, oh, it's all in your head. Well, yes, it is in your head. It's called your brain, and your brain chemicals are off. There's lots of reasons for that, but you don't need to suffer. There is help. Therapy is awesome. It helps you learn techniques to kind of break out of that thinking cycle. And also medication, eating better, sleeping better. So many people underplay that pregnant women often can't sleep. It's not that they don't want to sleep. They do, but they can't fall asleep. They can't stay asleep. So there are things to help with that. And honestly, we know that lack of sleep alone is a form of torture. So if you aren't sleeping well, everything else in your life is just awful. So getting moms sleeping and eating seem like basic things, but very important things really make a huge difference in mood.
Jennifer, what can family members do, husbands, dads, throughout the pregnancy to help with these? Can they look for signs? Can we just be, go down the street, get a milkshake? Well, what can we do to help here? Because it's kind of a helpless feeling.
It is a very helpless feeling. A lot of family members and partners do feel like, what can I do? This is her body. But just asking those questions, not just, did you sleep last night, but how did you sleep? Were you able to fall asleep? Racing thoughts is often a common symptom of anxiety. And then because you can't sleep, you're depressed because you're so tired. So just being aware that it's a problem, making it a priority. Women tend to kind of, again, underreport, not want to be a bother to anyone. So just asking those questions, like, what can I do to help you get to sleep? Can I help around the house more so that you can take a nap in the afternoon? And it seems like such a minor thing, but man, it makes such a difference. And just even getting an afternoon nap is great for better sleep at night.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Jennifer Bender, Perinatal Nurse Navigator and internationally board-certified lactation consultant, talking prenatal and postpartum care. We kind of touched on this, but some of the symptoms we were talking about, not sleeping, depression, anxiety, those can happen both during the pregnancy and after the baby has arrived, can't they?
Yes, definitely. I mean, everybody knows when you have a new baby that sleep is a high commodity. Babies don't love to sleep at night. They're up a lot, and everybody has a magic cure. But honestly, even if your baby's sleeping well, some moms are having trouble falling asleep and staying asleep. So again, the worse your sleep, the worse you feel. And then that just continues symptoms of anxiety and depression. So I talk about all the time, sleep is so important, but easier said than done for some people.
What differentiates depression from anxiety? Are they seem similar but different?
That is a great question as well. So anxiety is more of racing thoughts. Knowing that your fear is unrealistic, but not being able to get your mind off of it. A lot of moms have something called intrusive thoughts. These can be normal. We all kind of have them when we have a new baby, but these are thoughts that have gone awry. For instance, being afraid to take your child in the kitchen because you have an intrusive thought that says, I'm going to drop him in the oven. I mean, like, you're not going to drop your baby in the oven, but if it's overtaking your thoughts and therefore you can't go in the kitchen and make yourself food and you're going all day without eating, like, that's a big problem. Some moms will have a fear of falling down the steps with their baby, so they'll scoot down on their bottom. And the thing is, it's something we don't talk about. We don't say, hey, I can't actually walk down the steps. You just kind of do it and hope nobody sees you. So those are a problem when it's altering your daily activities with these thoughts. Depression is more of, I used to love to go out on a walk, and now I cannot get myself together to get out of the house no matter what I do, no matter who's helping me. So it's altering your daily activities.
I want to move on to how you treat some of these symptoms, and this may be an oversimplification, Jennifer, but it sounds like taking legitimate concerns, like when I carried my nieces and nephews around when they were infants, I was legitimately scared I was going to drop them. I'm clumsy, but it's taking it to an extreme, to an unrealistic level. Is that fair to say?
Yeah, very fair to say. Also, often family members are noticing these alterations and maybe bringing them up to you, but you dismiss them because, we often have a fear that if anybody knows the thoughts going through my head, well, they're just going to take my baby. We definitely don't want to take your baby. We know often these symptoms mean you're a great parent, and this can happen to dads as well. Mm-hmm. They can be hypervigilant, difficulty sleeping. If mom has mood changes, dad often experiences mood changes as well. So it can happen to either parent. So getting help, getting into your provider, prioritizing sleep, that might be getting some extra help you didn't think you were going to need. Maybe someone staying with the baby, watching the baby, so both of you feel assured you can sleep and somebody's keeping an eye on the baby in the beginning. And also, getting into your provider. Sometimes we just have a hormone change in your brain that is out of balance. There are medications that really make a difference. And also therapy. I cannot, tell you how important therapy is. We used to say therapy was just for people, that were a little off. I mean, let's be real, we're all a little off. And we can all use help in making sure, we're using the best techniques to break out of this thinking, because I say this probably 10 times a day, nobody wants to feel like this. You are not making yourself feel this way.
So the good news here, Jennifer, is if you are experiencing these types of symptoms, you're not alone. You're not the only one this has ever happened to, but they can all be treated.
Absolutely. That's one of the most positive things about perinatal mood disorders is they are so treatable and they do get better, which is excellent. Some long-term mental health struggles really are long-term and are lifelong. I think about it often like type 2 diabetes. Nobody wants to be type 2 diabetic. Your pancreas just isn't doing its job anymore. So we need help with that. And we don't make people feel bad for having type 2 diabetes. Like, come on, suck it up, just get it together. No, nobody does that to you. So mental health struggles are exactly the same. It's a hormone imbalance in your brain. So the good news about perinatal disorders is because it's pregnancy and postpartum related, it will resolve. The sooner we intervene, the fewer consequences and the shorter the duration. So it will happen to some people no matter what we do, but interrupting it and getting help makes the consequences so much less.
So and we're talking to Jennifer Bender, Perinatal Nurse Navigator, internationally board-certified lactation consultant. So what's the first step? You recognize these symptoms. You say, hey, something's off here. What's the first step in treatment?
Yeah, that's a great question. So the first step in treatment is talking to your provider, your OBGYN, your primary care. If you already have a therapist or psychiatrist, like being honest with them about how you're feeling. We're surveying our moms more because the reality is it is underreported. So we survey 3 times in pregnancy and at your 6-week postpartum appointment. We can also survey any other time through messaging, which is super helpful. And I can get you right into your provider. That is one of the great things about this role is, I can get you help quicker. I think the other hard thing is people say, I know I need help, but who do I call? I'm a source for that. I can get a referral sent in for you. I think the first phone call is the hardest thing. So that's why we're proactive about that outreach. So get into your provider and be honest about how you're feeling, and the help is available.
Yeah, certainly. For probably any sort of condition, the first thing is to admit that you need help. That's number one. But like you mentioned, number two is going, okay, I want help, I need it. Who do I call? It can be very confusing. It can be intimidating as well.
Very, very intimidating. And, one of the great things is, when you deliver at Mon Health, I can look at your insurance. I can figure out the best place to send your referral and just help you with that first hard step. We also have a great fund through Diversified Energy. We made a donation to our P3 program to help with the cost of therapy, because therapy can be expensive. So we don't want financial struggles to be a barrier for moms getting therapy and dads getting therapy. So we're super thankful for Diversified Energy and partnering with us. And so there's help.
Hey, you mentioned dads right there at the end. This is obviously, we've talked a lot about moms this morning for good reason, but is therapy available for dads? Because they too have to, make some adjustments there when baby arrives.
Yeah, yes, absolutely. And I've helped several partners get into therapy, and I'm always happy to help. I directly, outreach the moms because they're the one that had the baby, but I'm always happy to follow up with the dad. We have resources, and so, just send me your information and I'll get you the help you need. So
how can people reach out to you, Jennifer?
Yeah, so my cell phone is everywhere. This is a dedicated line, and that is 304-282-8511. You can also find it on our website. Very accessible. I love this job for that reason. I want to be accessible to people and get them the help they need. We've now expanded our program. We have 2 more people helping, so you may hear from someone else now as well. I just think that this program is going to be the way forward for all services in the future for any OBGYN office. We just got to get that concept out there, and we're working on that. So, we want to get people the help they need.
Well, we got about a minute here, Jennifer. What kind of feedback do you hear from mothers and families who have participated with the program?
Yes, the feedback's been fantastic. 91% of the people that replied to our survey said, they feel more connected to their provider because of this program. So the feedback is fantastic. I can't say anybody said, I don't like this, don't do this. And it's voluntary. You don't ever have to reply to me. So, it is something that you want to opt into. But, it's just tremendous. I know I love a message, and most people love a message. Even in my generation, if I don't know the number, I don't answer it. Today's mom does not answer a phone call. So this is a great modality to reach out to people where they are.
Jennifer Bender, our guest this morning, Perinatal Nurse Navigator, internationally board-certified lactation consultant. And again, you can always find more information at monhealth.com/OBGYN. Jennifer, enjoyed the conversation. Thanks so much this morning.
Thank you. Have a great day.
You as well.